Hello, this video could save your life or the lives of your loved ones. In the United States, approximately 795,000 people suffer a stroke every year, and the vast majority of them live with permanent disabilities because they fail to recognize the signs in time. And most importantly, this disease doesn't distinguish between young and old. The moment you notice the symptoms I'm about to describe, seek medical attention immediately. By watching this video until the end, you will learn the 5 vital signs of a stroke. If you or your loved ones have these symptoms, not just minutes, but seconds matter immensely. Perhaps you will save the life of someone you love thanks to this video. Additionally, I will talk about the most common causes of stroke in young adults. Don't leave the video halfway for your own sake and for your loved ones. Let's start right away. The first and most obvious sign of a stroke is a sudden drooping on one side of the face. This indicates that blood is not reaching a part of the brain. When brain cells are deprived of oxygen, the muscles they control stop working. Some people might think, my face feels a little numb. It will pass. This is exactly where your knowledge comes in. If you notice this sign in a loved one, you must act immediately. Now let's talk about how to test it. Ask the person to smile. In a normal smile, both sides of the face lift symmetrically. But in someone having a stroke, one side of the face sags and the mouth is pulled to one side. This simple smile test is a method you can apply immediately at home, and it can give you the same information as a $15,000 hospital scan in just 5 seconds. The second crucial sign is a sudden weakness or numbness in one of the arms. The right half of the brain controls the left side of the body, and the left half controls the right side. If there is a problem on the right side of the brain, the left arm and leg are affected. Important point, this weakness comes on suddenly. The person could use their arm normally 5 minutes ago, but now they can't. This sudden change is the most characteristic feature of a stroke. The way to test this is ask the person to raise both arms up and hold them for 10 seconds. The palms should be facing up and the arms should be at shoulder level. In a normal situation, a person can easily hold both arms up, but in someone having a stroke, one arm drifts down slowly, or the person cannot lift the arm at all. 70% of patients who notice arm weakness within the first 30 minutes and get to the hospital experience no permanent damage. However, 60% of those who delay for 6 hours develop permanent paralysis. Speech disorder was the most commonly described symptom in viral stroke videos over the past 6 months. Because it's the easiest to spot, speech is severely affected in people having a stroke. Speech becomes unintelligible. Words get jumbled. The person cannot form simple sentences. They have difficulty understanding what is said. They speak with a slur or distortion. In summary, someone having a stroke cannot easily say a simple sentence. According to 2025 CDC data, speech disturbance is seen in 65% of stroke patients, and unfortunately, people tend to overlook this the most. A simple symptom can lead to very serious consequences. The importance of these symptoms increases tenfold, especially if you are over 60 years old. Speech disturbance sometimes starts mildly, but it can worsen within minutes. Even the slightest speech disturbance should set off alarm bells. Now we come to the most serious sign of a stroke. If you or your loved ones have this symptom, never, ever ignore it, because it means you are racing against the clock with seconds counting. Sudden loss or blurring of vision in one or both eyes is a critical sign of a stroke. Vision problems include sudden blindness in one eye, double vision, darkening in the field of vision, blurry vision. In the American Heart Association's 2025 campaign, this sign was number 1. Last year, dozens of people recognized an early stroke in a loved one because of this symptom. The visual center is located in the back of the brain. When blood doesn't flow to this area, vision loss occurs. The important point is, many people think this is a problem with their glasses, but vision loss in a stroke is sudden and dramatic. In stroke patients presenting with vision loss, if treatment is given within the first 2 hours, vision can be fully recovered. But if treatment is delayed by 6 hours, 50% of patients suffer permanent vision loss. If sudden vision loss occurs, do not say, "Let's wait a bit. It will pass." Every second is precious. Unlike a normal headache, you experience a sudden headache of a severity you have never experienced in your life. This symptom is especially seen in hemorrhagic bleeding strokes. Characteristics: described as like a thunderclap to the head. Does not go away with normal painkillers. Accompanied by nausea and vomiting. Dizziness occurs. Neurologists say any headache described as the worst headache of my life must be treated as a stroke until proven otherwise. With such a headache, you must go to the hospital. Now we come to the most vital point. If you look at all the signs from a broad perspective and engrave them in your mind, you can save yourself and your loved ones. I will now tell you a very important rule so you don't forget it. The F.A.S.T rule. F, face. Is there facial drooping? A, arms. Is there arm weakness? S, speech. Is there a speech disturbance? T, since time, call 911 immediately. The F.A.S.T rule is one of the most important protocols applied by 911 personnel in stroke patients. Critical statistics: intervention in the first 3 hours, 90% full recovery. Intervention in the first 6 hours, 60% full recovery. Intervention after 6 hours, 40% risk of permanent disability. Intervention after 24 hours, 70% risk of permanent disability or death. There's a 30% difference between 3 hours and 6 hours. Every minute, every second is so valuable. Doctors call it the golden 3 hours. Clot-busting drugs given within the first 3 hours can completely save the brain. Stroke is a silent killer. It doesn't cause pain, so one might think it's not important. But brain cells are dying every second. 2 million brain cells are lost per minute. Save the F.A.S.T rule on your phone. Write it on a piece of paper and hang it on the fridge. You will know what to do in an emergency without panicking. Now we come to the causes of stroke in young people, which I mentioned at the start of the video. In the last 5 years, stroke cases among those aged 18 to 45 have increased by 30%. Here are the causes. Sedentary lifestyle, remaining inactive for hours. Stress increases blood pressure. Poor nutrition, fast food, excessive salt and fat, smoking and alcohol increases stroke risk threefold. Sleep disorders prevents the body's repair. You can prevent a stroke with small changes in your life. 30-minute walk daily reduces risk by 40%. Reducing salt intake reduces risk by 25%. Regular blood pressure checks once a month. Stress management meditation, yoga. Regular sleep 7 to 8 hours every night. According to the American Heart Association, stroke risk is reduced by 60% in young people who integrate these 5 habits into their lives. You have learned the 5 critical signs of a stroke. However, it is as important not to forget the signs as it is to learn them. You can even send this video to your loved ones to inform them about this issue, because a seemingly simple symptom after watching this video can save a life. What you need to do now: share this video with your family. Save the F.A.S.T rule on your phone. Add 911 to your speed dial. Get a health checkup once a year. Start healthy lifestyle changes today. Tomorrow might be too late. Like the video, subscribe. Remember, the knowledge you share is the life you save.